The Senate GOP health care bill has been public for more than 24 hours. There are now 5 Republican senators who have said they cannot support it, at least so far. Others have been non-committal, saying they need more information and are obviously still reviewing it. One Republican senator set his own litmus test back when the House version of the bill came out in May. Take a listen.
Could you support a bill that allows insurance companies to cap their payouts to customers?
As you present that, I asked, does it pass the Jimmy Kimmel test? Would the child born with a congenital heart disease be able to get everything she or he would need in that first year of life? I wanted to pass the Jimmy Kimmel test.
Well, Senator Bill Cassidy, Republican from Louisiana, joins me now. Thanks so much for being with us.
Anderson, thank you for having me.
At this point, can you say in your mind, if it does pass, if the Senate version passes the Jimmy Kimmel test?
There's no lifetime limits. Simple answer, yes it does. There's no lifetime limits. It does lower the cost of premiums. A big thing is, sure, you can have insurance, but if you can't afford the premiums, you don't really have insurance. And it does lower that cost. There's other things to consider, and that's what I'm looking at now. But simply put, if your child is born with a congenital heart problem, there would be no lifetime limits on the amount of on the cost of the care that she or he could receive.
Are there limits on sort of how detailed the plan is that people are going to be able to get? People may be able to get a cheaper plan, but that doesn't have as much coverage, basically. The
plan, which you're referring to as essential health benefits, again, it does not repeal the essential health benefits. So it still covers maternity, still covers addiction, still covers all the other things that you would expect it to cover. It's probably pretty good. Turns out those are only about 4% of the total cost of the premium. So I personally think that that's a small price to pay.
Are you ready to support it at this point?
No, I'm still working through it. We're about 2/3 the way through. I say we, my staff and I are looking at it. I've gotten 10 texts this afternoon as I wait for this. Stakeholders back home, if you will, looking at it as well. We're just trying to put it all together.
What are you hearing from, you represent Louisiana, obviously, what are you hearing from constituents? Is there, I assume you hear from both sides, but do you have...
I smile because I get one text, the guy saying, listen, my premiums are $1,700 a month, my deductibles are $6,000 for me, $13,000 for my family, you got to vote for it. The next text is, OMG, you can't vote for it because this is actually not right for our state.
I get the same text every night from voters saying...
Total.
Yes, exactly.
So what I'm trying to do is kind of cut through it. I actually emailed one friend back and say, listen, let me explain how it really works. And he emailed back in a more conciliatory tone. So a lot of what people are getting is almost, if you will, slamming the bill without understanding the bill. I seek to understand it.
The president had campaigned on not cutting Medicaid at all, not having any reductions in Medicaid. From a number of early analysis, the Senate bill does seem to limit Medicaid over the years.
A couple things. If someone gets off of Medicaid onto private insurance, that could actually be a good thing. So first, some of those patients going off Medicaid will go on private insurance. Secondly, what is poorly understood, under current law, the Medicaid expansion is not really sustainable for states. One example, in California, under current law by 2020, they would have to put up $2.2 billion for the state of California's share of Obamacare for the expansion. My state, $310 million. Really a big chunk of change for our state, which is relatively small. So under current law, Medicaid is not sustainable. It has to be fixed for the states themselves, and I would say also for the patients.
Do you have a sense of when you're going to make a decision on this?
Me personally?
Yeah.
Or I'm working through it on the weekend. I'll go in on Monday. I'll take as long as I need. Obviously, Leader McConnell wants to have a vote next week,
right.
So we're not cooling our heels. We're working hard. I'd like to know soon, but I will not decide until I feel like I understand the bill.
Senator Bill Cassidy, appreciate you joining us.
Thank you, Anderson.
Thanks very much. Welcome to New York as well. Up next, breaking news.